Good afternoon. Thanks so much for joining in. In looking at the trend in cases in Montana from the months of June and July to date, we have 9 counties in Montana that we consider hotspots. Those 9 counties have 50 or more cases. They comprise about 80% of all cases reported during June and July. Those counties are Flathead, Lake, Missoula, Lewis and Clark, Cascade, Madison, Gallatin, Yellowstone, and Bighorn. Some counties do have unique situations. In Yellowstone County, 19% of the cases are connected to assisted living or long-term care facilities. There are certainly patterns of similarity among the trend in cases that we've seen throughout June and July. Throughout this pandemic, from March through July, the proportion that we've tested among the age groups from 0 to 9, 20 to 39, 40 to 59, or 60 and up have remained about the same. And while we're testing more across all the age groups, we're seeing more and more that the younger age groups are contributing to our increase in cases. The rate per 100,000 that have tested positive in June and July has dramatically increased among the 20 to 39 age group, and in particular, actually the 20 to 29 age group. In Gallatin County, 3/4 of the cases have come from those younger than 40. If we're just looking at those younger than 30, it would be 58% of the cases. In Missoula, 2/3 of the cases have come from those under 40. Half of them under 30. In Yellowstone County, over half of the cases are age 39 and below. Young adults are certainly more likely to socialize in larger group sizes, and we know that large gatherings continue to play a role in the increase in cases. This is everything from the wedding festivities that we saw clusters in June to 4th of July festivities with big groups to gatherings at bars. But we also know that where social distancing and good hygiene is practiced and masks are worn, that transmission rate in large group sizes significantly decreases. Last week I had the opportunity to visit the Billings Depot, which is a community center. It's a wedding venue in the city of Billings. Yeah, that's right, a wedding venue that has 0 positive cases and strives to keep it that way because they're doing everything right. They have a touchless temperature check system in place for everyone that comes in. Masks are required for all guests and for all workers. They work closely with the vendors prior to and during the event, from the caterer to the DJ, to make sure that everyone plays by the same rules with the enforcement of safe sanitation practices and social distancing. They even have a technology that maps the layout of the room when a wedding party is planning to ensure 6 feet between guests. But what I guess really struck me from what I learned during this visit was how the Billings Depot encourages couples to select their venue for weddings. They know that if they aren't there to do the job safely, then instead a couple may just host a wedding in a backyard and not follow any of those protocols to keep their guests safe. Couples too choose the venue because they know it's safe and they want to keep their loved ones safe as well. No one wants their wedding to turn into the next cluster, and the same goes for other establishments like bars and restaurants or other areas where gatherings occur. That's preventable. Cases are less likely to occur if the right preventative measures are taken at these establishments. Employees need to wear masks and make sure that their guests are wearing them as well. Continue to sanitize and enforce social distancing between tables. Implement temperature checks or system screening on all staff. And don't allow anyone to come to work if they have symptoms. At this time, we're carefully reviewing the patterns we're seeing in these 9 hotspot counties. I know that capacity to get our hands around this virus in some of these communities is actually getting difficult. We'll be working with local public health officers in the upcoming days to determine if additional common sense measures can or should be taken to both deploy additional resources and/or steps to limit the spread. In this vast and diverse state, certain communities may have to take some specific measures to tackle their unique situations. That's what we'll be evaluating in the near future. At the same time, in this vast and diverse state, we're still in this together. And each of our actions have a direct result on others, no matter if we live in a county with 5 cases or a county with 500. Yesterday, we reached over 50 deaths in the state due to COVID-19. While our seniors remain the most vulnerable, so do younger Montanans with underlying health conditions. We've recently been reminded that this virus can even take the life of someone in their 40s. And otherwise healthy Montanans can experience extremely challenging short-term and life-altering outcomes when they face this virus. Montanans who recover from this disease could still need ongoing care for heart, fatigue, lung, and other issues. This virus doesn't just impact our seniors and immunocompromised Montanans. And as we learn more about this virus, that's becoming increasingly clear. I'm now going to turn it over to Caty Gondeiro to share her experience with testing positive for COVID-19 at the age of 23. Caty.
Thank you. My name is Caty Gondeiro. I tested positive on July 7th. And I'm 23, I'm healthy. I really didn't think I was high risk for this. I did not worry about catching it. I was just not being as careful as I should have been. And the symptoms are very real. This is nothing to be taken lightly. I am going on over 3 weeks now, and I'm still recovering. And I still haven't, I can go for light walks now, but this has very drastically impacted my life and my day-to-day. So the symptoms started with chest pressure, just fatigue. I was just really tired and feeling run down all the time. This progressed into fevers, body aches, loss of appetite, loss of smell, and then I think at its peak, I was kind of experiencing everything all at once. And so I would just like to say that please don't take this lightly. And I think that it's really important for people my age in the 20 to 29 age group understand that we are really we're driving the spread of this, because while we may recover from this, we all know people and have people in our lives that won't. And that's something that we need to be mindful of. We have a responsibility to protect the people around us. And it's our jobs to be mindful and considerate of our engagements, wearing masks. You know, when I tested positive, I wasn't worried about the social events I was going to be missing. All I was worried about is the people in my life that would be impacted by this. Because I'm young and I'm healthy and I'm active, and I still need a nap every day now. It's slowed me down substantially, and there are, you know, there's going to be lasting effects from this. I still get winded doing simple tasks. I went for a walk yesterday and I could feel it in my lungs today. And I am just trying to, increase my activity day by day, but there's limits to what I can do now. I have noticed a lot of neurological symptoms that I didn't know were going to be a thing. I am forgetting things a lot, just not super functional. My mind just feels constantly clouded, and there's a lot more to it than, it's not just, people say, you just get the flu and get over it, and it's no worse than a bad cold. This is much more serious than that. And for me, being healthy and 23 and having this experience, I can't imagine being in a high-risk group or in a high-risk age range where I wouldn't necessarily recover at the speed I have, because there are people that won't be as fortunate as I was. So I would just like to remind everyone to wear your masks, and please be responsible and considerate of people at high risk for this. Thank you.
Thank you, Caty. From our eldest Montanans and to even the youngest among us, again, this virus does have an impact on all of us. I'd like to next share with you a video that's part of the Mask Up Montana PSA campaign.
My name is Dr. Lauren Wilson, and I'm a pediatrician here at Community Children's. I just got done seeing a 3.5-year-old boy who's here for chemotherapy. He has terminal cancer and he's COVID positive. His family asked me to give you the message that if Montanans mask up, if you wash your hands, if you social distance, they won't have to be quarantined and separated from their child in his last weeks of life. Montana is about protecting our vulnerable. Please do your part and mask up, wash your hands, and social distance. Mask up, Montana.
It's now been about 2 weeks since we put the mask requirement in indoor spaces open to the public and certain organized outdoor gatherings with counties of 4 or more current cases. Regardless of the mask requirement, all along the way, we'll continue to educate Montanans and raise awareness of mask wearing as an effective way to curb the spread of the virus. You'll see that the Department of Public Health and Human Services is launching numerous PSA campaigns, including the one that we just showed, featuring healthcare and local public health officers from across our state, sharing their personal stories of the importance of taking these steps to protect one another and the importance of masking up. This is in addition to our continued rivalry and camaraderie between the Grizz and the Cats. Because one of the most important things that we can do to keep moving forward is certainly tackling this virus is by continuing to make mask wearing a habit. It's as simple as this. The more Montanans are educated on the importance of masks and follow the requirements, the more likely that we are to get our hands around this virus. We continue also in another area to work towards rebuilding up our testing capacity so that we're once again able to engage community members in asymptomatic surveillance or snapshot testing, and also making sure that Montanans get their test results back in a timely manner. Understand that there's been frustrations among those who participated in community drive-through events and have not received the results back for what's now over even 2 weeks. I'm frustrated as well. And we continue to push on Quest to complete the analysis of these samples so that they can still be at least of some benefit for contact tracing. Quest is communicated that they should be through their backlog by the end of this week. Since finalizing our contract with a North Carolina reference lab, Mako, last week, they've performed around 4,000 tests for Montanans. The Montana State University lab, which we spoke about last week, it's working through the validation. We anticipate that they're going to be running tests real soon. State lab continues to perform tests with a quick turnaround. They're currently prioritizing those with symptoms, close contacts, and outbreak investigations, as well as frontline workers and residents of congregate care settings. Over the previous 4 weeks, we completed around 70,000 tests. So we know that our goal of 60,000 tests a month is certainly attainable. We'll continue to strive toward meeting this goal and ensure that those who need a test are getting one with results in a timely manner. But most importantly, our top priority is to make sure that we're promoting and encouraging the testing that will help us best control the outbreaks and protect our most vulnerable citizens. As Congress deliberates the next coronavirus relief package, a topic of discussion's also been providing dollars to state and local governments. The proposal, at least discussed out of the Senate side yesterday, my understanding is it would allow us to use a portion of our existing $1.25 billion to provide revenue replacement for state and local governments. The nation's governors collectively have been calling for $500 billion in new dollars over the next 3 years to support state and local governments that have experienced pandemic-related revenue shortfalls. We here in Montana are fortunate to have started this pandemic in a stronger fiscal position and would be able to manage with existing funds if needed, unlike most other states across the country. But new money would allow us also to both take care of our local governments and state-related COVID costs, while also allowing us to use more of our existing dollars for the Montanans, businesses, nonprofits, healthcare providers, ag producers, and more who've been impacted. There are sectors starting to see long-term impacts, and we want to be able to also address those long-term challenges, because we don't know what the future holds with this virus. In anticipation, the Congress would be debating either flexibility with existing funds or new funds this summer. Another reason why we've held on to some of the $1.25 billion that the state was allocated. Absolutely critical that we spend this money responsibly and are able to adapt to any future changes or challenges. And that includes having to wait and see the final changes Congress makes and subsequent guidance to states on the path forward. I know that some think we should spend it all in one place without transparency or without due diligence to make sure that the money's going to people who need it, but that would also be irresponsible and would hurt Montanans, businesses, and local governments in the long run. To close with one final announcement, the coronavirus relief funds for schools application is now live. Public and accredited private schools can now apply on the Department of Commerce website under school funding for pandemic-related impacts. First application deadline is this Friday, July 31st, with payments made on August 7th. The second deadline is August 14th, with final payments made on August 21st. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Maritza Giorgio with NBC Montana. Thanks for holding this. And I have three questions, sorry. My first question is, Yellowstone County is starting to show an outpacing of resources on their website, and Roosevelt County actually had to shut down their health department because an employee tested positive for COVID-19. I'm wondering if you're concerned about our local health departments and having adequate resources for them to do their jobs.
Well, certainly, and Maritza, in each of those cases, like in Yellowstone County, it was about a week ago that we worked to try to find and get them actually additional contact tracers. We're in regular contact with each of the public health departments and the county, and where assistance is needed, we'll help provide that assistance.
Okay, my second question is, anecdotally, I'm hearing that some employers are encouraging their employees to work through symptoms and not give up close contacts. I'm wondering if there's some kind of harsher penalty you would consider enforcing for directions like that.
Well, anecdotally, I haven't heard much about that, but I hope that certainly every Montana business, look, you don't want to become the cluster as a result of having symptomatic employees showing up at your job. So from the perspective of, I certainly would hope and expect this wouldn't become a problem, because we also know that if additional employees get there, that will absolutely shut down your business. So hoping that employers will work carefully with any employees that are symptomatic and work with public health to quarantine, and as long as they do, this won't become an issue.
And lastly, thank you for your patience. I'm wondering if you have any idea how many of our test results are pending still because of that national backlog.
Do we know how many are at Quest at this point?
Quest has about 7,000 Montana tests still pending.
So, Maritza, Quest has 7,000 Montana tests still pending. They've communicated to us that they hope to have that backlog all done on by Friday, and then we won't be sending tests to Quest.
Hi, this is Phil Drake.
Hi, Phil.
Was wondering. Hi, how are you doing, sir?
Good.
Was just wondering if you have made any decision from the clerks and recorders regarding the November 3rd general election and mail-in ballots.
Sure. Just recently received a report from the clerks and recorders, like I did when made the decision for the primary election. Certainly be consulting with those county election administrators, public health experts, emergency management professionals, and the Secretary of State's office. The clerk said that what they need is a decision, I think in what they sent me was by August 10th, so we'll make that determination before that. Those discussions will be occurring soon to ensure that they have time to prepare for a safe election. Next
Hi, Governor. This is Corin Cates Carney with Montana Public Radio. Wondering, the latest DPHHS analysis says Montana's weekly positive rate for all laboratory tests is around or above 4%, which is around the same positive rate in late March when you called a stay-at-home order in place. What's different now that keeps you from issuing another stay-at-home order?
So, and we'll certainly continue to look, we know, as I noted before, 9 of our counties have 80% of all of the cases. We know that we are testing a lot more, but that doesn't necessarily mean that, it's not because of more tests that we have more cases. It's because it's prevalent around. And I think unlike in March when this was all new to us as Montanans, we know the steps that we have to take to limit the spread of this. And that's the social distancing, that's the hand washing, that's not going to those large groups, and it's also wearing masks. I mean, I've looked even in, you look at it that, and when it comes to masks, it'll take 2 to 3 weeks to begin to notice the real public health benefits. In some states that implemented mask requirements early, took 6 weeks. If you even look at a week isn't a trend, but over the last 2 weeks, we've stayed relatively steady at the same numbers where they were spiking up substantially, I think going from 300 to 700 the week before. So we'll continue to, as we have all along, look at this as a public health issue and work with public health as far as the best ways to try to contain the spread of this virus.
Hi, this is Perrin Stein from the Bozeman Daily Chronicle. I was hoping you could explain what the return times are now for test results for the symptomatic and close contact testing, and when you'll be returning to the levels of asymptomatic testing that you guys were doing about 2 weeks ago.
So the return time for symptomatic is probably 2 to 3 days at most. Those are all run through typically through our state health lab at this point. And when we'll get back to the surveillance testing, our community snapshot testing, as we were a couple of weeks ago, pleased that we have a reference laboratory in North Carolina on board. I think once we get the Montana State University lab up and running, we'll have the capacity to do the same amount. So I look to that in literally the upcoming weeks, the next week or two. Next phone question.
Hey, this is Holly. How are you doing, Governor?
Doing okay, Holly. How are you?
Good. I have 2 questions, one for you and then one for Caty. I don't know who I should start with.
Why don't you start with me since I'm up here?
Perfect. So I was looking at, there's a new report out from the White House that includes some data and recommendations for Montana, and it's suggesting some more restrictive measures for a couple counties than what we've got in place right now, such as closing bars in counties this defines at the red zone, and then more limits on capacity at counties where they're kind of defining in this yellow zone, which is about a dozen counties in Montana. And I'm wondering, as the White House puts out reports and guidance like that, how much you take those into consideration as you're making decisions for the state or working with counties on what their local decisions are?
Yeah, and Caty, I'm sorry, you're next, Caty. Holly, when it comes to sort of, the group sizes and the like, and that's one of the things from our perspective, even setting that limit, that it certainly shouldn't be anything larger than 50 where social distancing isn't possible. And even in a group of 50, people should be wearing a mask. We have received that report, as well as just had a meeting yesterday with the epidemiologists. And as I said earlier, we've identified 9 hotspots in the state, and we're going to work with local public health in those communities to try to figure out what is the best approach to fit the needs in making sure that we're able to mitigate the spread of this virus. Something that we've been trying to do. Go ahead.
Okay. When you're working with local public health, do you foresee that being working with those counties to have them implement their own restrictions, or do you see that being the state setting additional restrictions for counties that meet a hotspot threshold?
So, sure, it could be either way. Now let's first and foremost, right? If in any of these counties, if the 2/3 of folks under 40 in Gallatin County, as an example, start taking this seriously, we're going to see numbers going down, and it could end up not being a hotspot. So first and foremost, it's incumbent upon all of us as Montanans to follow the guidance of state and local health, and that's how we know that we can mitigate the continuing increase. But it could well go throughout this whole time. I've certainly made it so that the state requirements that I put out are directives. That doesn't preclude local communities from taking more restrictive measures. If we decide that we need to take more restrictive measures, it could either be done even selectively at the county level, or I at the state level could put out directives that doesn't impact the entire state, but only a portion of the state.
Okay.
You ready for Caty?
Yeah, definitely.
Hi.
Hey, Katie. Sorry if I missed this, but I wanted to ask, and if you said this again, sorry, but where you're from and where you're located now in Montana. And then was wondering if you had any idea about where you might have picked up the virus, and if you could talk a little bit more about how it felt going through being in isolation, kind of what that process was like. And you talked about the stress you felt of putting people you're in contact with at risk for getting the virus, just how you felt going through all that, as you're also, sick and trying to recover from this.
Right. So to answer your first question, I'm currently located in Helena, but I'm raised in Montana, just kind of all over. But I don't know where I picked it up. I wish I did, so I could pinpoint exactly what I was doing, so I could, educate people on how to be more careful. But we don't really know where I contracted the virus. As far as isolation goes, I am in constant contact with my family members, and my parents are they're close to the high rate. Oh, my mom's gonna kill me. They're close to the high risk age ranges, but they're not quite there. Anyway, so it's a little stressful because you never know how it's gonna impact people. And that was my biggest concern, is just trying to keep myself as isolated as possible. And luckily, because of my lifestyle already, it wasn't like a huge adjustment for me as far as trying to limit my contact with other people outside of my household. So really, it was just more stressful as how can I avoid giving this to my family members.
Awesome. Thank you. Glad to hear you're starting to feel better.
Thank you.
Question.
Hi, Governor. Jeremy Snow from ABC Fox, Montana. So it's coming out that schools are going back to are coming back, and there's been some talk about reopening schools without requiring masks for elementary school students. It was just passed yesterday in the Hamilton School District. I wanted to know what you thought about that.
I think, look, that we know that ages 5 and up is when our kids are in school. And we know that, while there may be less of an impact on, by and large, for a 5-year-old or a 7-year-old's health, if they get COVID-19, that every one of these children end up in contact with more vulnerable individuals. And look, I am pleased by and large that, even in the last week or so, that the president said this is patriotic to wear a mask. Was on another one of our White House calls yesterday where they looked at Arizona being a hot spot, yet by actually wearing masks and by adhering to social distancing, by staying away from some places, the large gatherings, that they are seeing that it may have been as effective as a stay-at-home order. And we heard from Dr. Fauci, we heard from the Vice President, we heard from Dr. Birx. As they're looking at this across the nation, that the best way to curb this spread and make it so that we're not shutting down everything are those steps like wearing a mask and practicing social distancing and avoiding large gatherings. So, as a governor, as a community member, and also as a parent, I would hope that every school district would say, we need to take the most protective measures for our kids, which include a mask in requirement. And we're doing it in every other public building. So I'm hopeful that places like, if it was Hamilton, I didn't see that report, that we'll actually take the responsible steps without me having to put out requirements.
Will you be trying to talk to those different school districts and try and get them to reconsider?
Well, I think first the parents will probably be talking to them. And from that perspective, yeah, we'll take a close look to see what's happened along the way. And if we can provide them some additional guidance, certainly we'll do so. Next phone question.
Yeah, Governor Bullock, this is Mike Kortenbrock with the Billings Gazette. Wanted to ask you specifically about the situation in Yellowstone County right now. Yellowstone County has about 38% of the active cases in the state. I think it's got somewhere in the range of 60% or more of active hospitalizations. And I think it was last week, our county health officer said that cases in our county have been tied to 13 other counties and 2 reservations. How critical is what's happening in Yellowstone County right now to the rest of the state as we confront this pandemic? And secondly, what specific actions are you looking at taking to help deal with the increasingly strained resources in Yellowstone County?
And Doc Holzman, did you work as far as contact tracers, or do you? Yeah. So your question was, how concerning is it that, the largest county in our state is not only have substantial impacts within that county, but we also know that, like if you go from Bighorn, part of that is cases connected to travel to Yellowstone County and others. I mean, we know that right now the median age of cases in Yellowstone County is 38 years. Age 38 is sort of the median age. It is really concerning. And Yellowstone County, just like the rest of the state, has to certainly take this seriously along the way. Take seriously the recommendations of county health when it comes to things like large gatherings and possibilities where additional spread can occur. And certainly hopeful that, and count on county health or the public health reaching out to us when they have either supply constraint needs or other needs. Think about a week and a half ago, when there were some concerns about contact tracing and having sufficient staff for contact tracers. And we did provide a pipeline for some additional contact tracers there. But we want to, and we keep in touch with both on the healthcare side and the public health. The communications are fairly regular, and if there are concerns or needs that are unmet, certainly expect to hear from John Felton or the county commissioners or others.
So, I mean, have there been any other conditional concerns raised? Have there been any other requests made to your office?
Other conditional requests for resources, or I'm not sure what you're...
Yeah, for resources out of Yellowstone County. I mean, I'm just curious if you mentioned those communications are regular and that you guys, stepped up to help with the contact tracing. I just wonder if there are any other areas of concern that have been brought to your attention in Yellowstone County.
Yeah.
In terms of those resources.
Yeah. And I'll have, I speak to John Felton every now and again. When I say, we've had conversations, I'm talking about the whole healthcare team on this. I'll turn it over to State Medical Officer Doc Holzman.
Thank you, Governor. Yeah, we're in constant contact with, as the governor said, both public health and with the medical group. If they are asking for things, we're going to do our best to try to help in that way. Some of the issues have been contact tracing. The other area that we have been in contact and working with the hospitals is a medication called remdesivir, which has been used for patients around the state of Montana for individuals that are having some challenges breathing, have known COVID-19 for a treatment, which so far has been shown to help decrease the time that they spend in the hospital, and more studies are being done on that. So those are some of the interactions that we've had. I think it's really important when you look at public health, there's really two things that we're trying to do. One is trying to stop the spread of the virus, and those are all the things that we've been talking about, limiting your large gatherings, making sure people are wearing masks, washing your hands, social distancing, all those kind of things. And then the other thing is to control the outbreak of when they do happen. And that's going to be done by the contact tracing, making sure that citizens are doing their responsible thing to do and staying isolated when they're told to be isolated, and staying quarantined when they're supposed to be quarantined. And us to get the testing done on those individuals that are close contacts. The local public health there is working extremely hard, and they appreciate, I'll speak for them on this one time, but they appreciate when people are following the guidance that they're giving out, so that they're not having to spend as much time if they tell somebody to be quarantined, that they stay in that situation, even if they're feeling well. It's the best way that we can keep the spread down and get that outbreak under control. Thanks.
Hello, Governor. This is Nikki Willett from Yellowstone Public Radio. Thanks for holding this conference today.
You bet, Nikki.
Dr. Holzman just kind of answered the first of my two questions, but I'm curious, outside of Yellowstone County, have other counties gotten in touch with specific resource asks or other concerns?
Go ahead, Doc. I mean, yeah, I'll have Dr. Holzman as well. Like, on a fairly regular basis, one of the things that, I guess, to presage it, be it a remdesivir or be it supplies, like, there's fairly regular, constant communication both from the disaster emergency services side of it and public health is often speaking. Infectious disease docs have a regular phone call. There's discussions among hospital administrators. So the communication is something that, by and large, is occurring, it's no exaggeration to say, on a daily basis. But if, Doc, if you have anything to...
I really don't have much more to add except to say that we communicate with our local public health. They have our numbers. They have my personal phone number, many of them, and individuals will call, and then we try to work out problems together. I consider local public health my brothers and sisters. They're in the same thing that we're doing, and we're all working for the exact same goal. The new aspect to me and my family, in my work family, has been DES. And they've been awesome to work with, and so many of the resources that our local public health are asking for, whether it's been early on with aspects of PPE, personal protective equipment, swabs, whatever the aspects are trying to do, we're trying to get that out to the right place in the right time. So hopefully that everybody knows that they can give us a call in between if they need to. And then we have a weekly call in public health with the leadership of AMPHO, which is the Association of Montana Public Health Officers. And then we have bi-weekly calls with local public health. In between that time, though, people have my contact and Jim Murphy's contact constantly, so, and many others within our team.
Thanks. And then, Governor Bullock, are you heading into these discussions with hotspot counties with a perspective from the state about thresholds that, you know, if those counties dip below this threshold, they should take some kind of restrictive action? Like, does the state have a point of view heading into these talks?
No, I think it's, as we have all throughout, having discussions of how do we best curb the spread, and recognizing that different counties have different situations. I mean, but one of the real similarities in most of our counties is sort of that a lot of the transmission's coming from those under age 40. Last question.
Hi, Governor Bullock. This is Jonathan Henninger, Montana Free Press. I was just wondering, when you're talking about the people in their 20s and 30s who are spreading the virus more than anyone, and they're also the people who make up the bulk of the service industry and who are having to work throughout the pandemic. And I was just wondering if it's realistic and if it's fair to ask them to go back to work and then put the rest of their lives on hold, and whether you think that that's a real thing that is going to be effective.
If it's, I'm sorry, I don't think I quite understood your question, Jonathan.
Is it realistic to ask a bunch of young people in their 20s to go back to work and then not get together with people and just resume the rest of their daily lives?
Well, I think it's realistic to ask a 20-year-old or a 50-year-old or any age to take the steps that we know that we need to do to limit the spread of it. And as I've said time and time again, look, there's a whole lot of fatigue about COVID-19. Like the novelty from March when this was first impacting us has worn off for everyone. But the virus is still here. So whether you're age, like we know from just looking at what our cases are, that the vast majority of the positive transmissions today are under age 40. So we'd ask everyone at whatever age you are to take this seriously and make sure that we are doing everything possible to limit the transmission and spread of COVID-19.
Hey, how do you get this Mask Up Montana message through to the liberty-minded folks who seem to be galvanizing their cause? More and more people ask them to wear masks, you know, the folks that were at your house.
Well, I think, look, and first, like on that, right? I mean, all Montanans have the right to have their voices heard. You know, as I've said, with every demonstration that's occurred throughout this pandemic, though, then I urge Montanans to actually do so in a way that's safe, mitigate the spread, including things like staying home when sick or wearing a mask, social distancing. I think that we should begin with the understanding of more than a mask requirement. You know, if you go down Main Street or Last Chance Gulch in Lewis and Clark here in Helena, most folks are taking this really seriously. And they're taking it really seriously not because it's a government requirement. They're taking it really seriously because of Caty Gondeiro, or the fact that we don't want to be taking steps back. There are some that are very resistant. Like that was one of the steps along the way, even when we put this requirement in. I think I had mentioned, we talked about it some here, but we wanted to get more social acceptance. We're so pleased where businesses stand up. Business organizations, the Tavern Association, others saying, let's do this because we want to both keep our community safe and keep people healthy. And I think even as you see, as I noted before, when you see national leaders, Democrats and Republicans, I mean, I have been pleased by and large with the messaging from the president over the last week or so, where he too has said, if we want to all stay open and actually curb this, we've got to take steps like wearing a mask. it's not the directives that drive all of this. It's people actually, as we are in a state where we care about our neighbors. And I think we have seen much more social acceptance. We still have ways to go. But let's also focus on everybody that's getting up each day and going to work and making sure that they have a safe workplace. And those that are actually, took steps even without a masking requirement. I mean, recall that it wasn't like the masking order, which made the largest retailer in this nation, Walmart, say that we're going to put in requirements along the way. And let's all just work together on this, be kind to one another along the way, and collectively is how we're going to end up making it so that the virus isn't continuing to spread. Thank you very much.